Hi, my name is Enrica Hampton. I'm a member of the Positive Early Learning Experiences Design Team, and it's an honor to share information about this statewide early learning strategy with you. One hat that I wear or role that I play in supporting young children and families is through my daily work as an early learning manager and a child care and preschool consultant at Kindering, a nonprofit neurodevelopmental center in King County. But like you, I wear other hats as well that support and influence my actions and thinking related to early learning, including that of being a very proud godmother and auntie. There are many systemic inequities that disproportionately impact Black, Indigenous, people of color, and other marginalized communities. The Early Learning Coordination Plan and Strategy reflects an aspirational vision for eliminating long-standing inequities in early learning outcomes and ensuring that children and families are healthy, happy, safe, thriving, included, know that they belong, and are getting their individual needs met. This is why I'm committed to a strong statewide early learning strategy, as is everyone that has been involved in this and the other design teams. If you have not already done so, I would encourage you to watch the introductory video. The introductory video provides background on the strategy and how it was developed. There were two foundational concepts. The first, to create good outcomes for all children and families in Washington State, we must resolve inequities for Black and Indigenous people and people of color. The second, a successful, strong, statewide early learning strategy comes from the community. This collaboration included design teams made up of parents, caregivers, early childhood professionals, state agency staff, and many others. There was public outreach to more than 2,000 people. As a member of the Positive Early Learning Experiences Design Team, I'm going to share goals and strategies specific to what children and families experience when they interact with Washington's early learning system. Our early learning system in Washington State is broad. Public and private services, programs delivered in formal settings, at homes and in communities, and services that meet specialized needs. Examples include Early Childhood Education and Assistance Program, also known as ECAP, Head Start, Family, Friend, and Neighbor Care, Home Visiting, Early Support for Infants and Toddlers, also known as ESIT, Developmental Preschool, Early Childhood Intervention and Prevention Services, also known as ECLIPS, Play and Learn Groups, and many others. The Department of Children, Youth, and Families, or DCYF, recently completed Washington's first statewide assessment of need throughout the early learning system, including broad outreach to providers, parents, and others. And here's what we learned. We learned that the state has made a lot of progress in delivering high-quality early learning experiences. However, gaps continue to be seen in both developmental and educational outcomes for children of color, children in tribal communities, children with disabilities, and for children whose first language is not English. We learned that children in migrant families, families who are experiencing homelessness and housing insecurity, and families in rural and remote regions often struggle to access services. We discovered that early learning opportunities in Washington State are more limited for infants and toddlers than for any other age group. The unmet need is especially impactful for the most vulnerable families. The cost of childcare continues to exceed what many working families can pay. Washington ranks among the least affordable states for childcare in the nation. We learned that many parents and caregivers with children who have special needs, whether those be special needs related to trauma, developmental delays, and developmental disabilities, to name just a few, say Washington needs more programs and services for these children and more child care providers who have the experience and knowledge to support them. Finally, we learned that many families from communities of color, from tribal communities, and from immigrant and refugee communities are asking for services that respond to, respect, and value their unique cultures and parenting practices. So we started with broad goal statements. The goals are what we hope to be true, what we want to achieve together. Then we developed strategies to accomplish those goals. Some strategies address a single goal, but most are designed to address more than one. And this is where we stopped, because successful strategies come from the community, and more voices from the community are needed to ensure that we are on the right track. So, a plan for acting on these strategies will come only after we have your thoughts and feedback. So this is your opportunity to let us know, what do you like? What is missing? What needs to be changed or worded differently? Now is your opportunity. So here are the broad goals. First, positive early learning services and supports are available and affordable for all children, with an emphasis on creating availability for Black, Indigenous, people of color, children with developmental disabilities, and for people that are located in rural areas. Second, children with developmental delays, developmental disabilities, children who have experienced trauma, and children with other specialized needs are nurtured and their families receive the support that they need. Third, every community has inclusive and culturally responsive resources and activities delivered in the language of choice to families, available at no cost to families, eliminating inequities for Black and Indigenous communities and communities of color. And the last broad goal, transitions for children and families from prenatal through third grade across ages and between programs and services are smooth and welcoming and ensure continuity for children and families. So those were the broad goals. Now, here are the strategies to help achieve these goals. First, make social emotional training accessible for early learning professionals, caregivers, families, and community partners, with a focus on anti-racism and cultural and language relevancy. Second, make early learning services affordable for families who struggle to afford childcare. Do this by changing the state's income eligibility from federal poverty level to area median income and eliminate the benefit cliff for services. Third, replicate promising programs that are successfully supporting the learning and development of Black and Indigenous children, children of color, children who are English language learners, and their families. Fourth, expand high-quality preschool options to create an integrated approach to serving 3- and 4-year-olds. Programs and services should engage families and provide responsive support for underserved communities and children. Fifth, expand access to home-based services for expectant parents and families with new babies and young children, focusing on families at greatest risk. 6, Ensure cultural practices, norms, and home languages are fully integrated in early learning for children birth through third grade. 7. Support children and families through transitions, creating strong relationships with new providers and teachers. These supports will help to eliminate inequitable outcomes for Black and Indigenous people and people of color. 8. Invest in culturally responsive community activities that help parents, families, and caregivers support children's development and social interactions. And 9th, and finally, create inclusive settings that enable children with developmental delays, developmental disabilities, children who have experienced trauma, and children with other special and complex needs to learn and grow with children their age.